Thank you guys for having me. As you mentioned, today we're going to be talking about cardiovascular health. And why is this important? It's important because heart disease is the nation's #1 killer, causing 40.6% of all deaths. That's nearly half of all deaths. And it's more than the next 4 leading causes of death combined. And stroke, which is also covered under the AHA, is the #5 killer and the leading cause of serious long-term disability. And this is a particular concern now because for the first time in decades, we're actually seeing deaths from heart disease and stroke on the rise. For a long time, we're actually seeing a steady decline in the cause of death from heart attack and stroke. And recently, in the past couple of years, it's been on the upswing. We're going to talk about why that may be and what are the things we can do to change that trend. So as we talked about, heart disease, #1 cause of death. Just hit the pointer. #1 cause of death, stroke, #5. 42.6% of adults are overweight. This could be one of the contributing factors to the reason why these numbers are on the rise. This is starting at an earlier age. 17% of our children are overweight. 17% of adults are still using tobacco despite the known risks of smoking. 20% of adults report no physical activity in the last month, so activity levels are on the decline as well, which could be contributing to the reason why these numbers are going up. 27% of adults have high blood pressure, which is why we're checking blood pressures here today. And we'll talk about why blood pressure in particular is a major concern. Part of the reason is that oftentimes you have no symptoms when you have high blood pressure. You don't know that you have high blood pressure, yet you're getting damage from this elevated pressure that you don't know about. And that happens in about a quarter of the population. 40% of patients nearly have high cholesterol, and 8% of patients adults have diabetes. So you put this all together, and what you see is an upswing in the risk of heart attack and stroke. And the reason why information sessions like this are important, it's because we can do something about it. Heart disease and stroke can be prevented 80% of the time. So it's the cause of death almost 40% of the time, and 80% of that can be prevented. So if we can address some of these factors, we can actually make those curves go down once again. And so what if you had a guide to guarantee longer life, to prevent heart disease, to feel stronger and healthier now and later, to provide a better quality of life as you invest in relationships and life goals? Wouldn't that stuff be worth doing? And that's what we're here to talk to today. And the AHA has developed this Life Simple 7. By doing these 7 basic things, and we'll touch upon each of the 7 today, you can achieve a healthier lifestyle. Stop smoking, eating better, getting active, losing weight, managing blood pressure, controlling cholesterol, and reducing your blood sugar. By doing these 7 things, you're going to decrease your own risk of heart attack and stroke. So the first thing on the list, and by far the most important of the 7, is to stop smoking. And if you don't smoke, to never start. Smoking is easily the leading cause of heart attack and stroke. So smoking, particularly tobacco smoke, causes ulceration in blood vessels. So blood vessels are tubes all throughout your body, inside your heart, in your kidneys, in the neck, go to the brain. When you smoke, you cause damage of the lining of the blood vessel. The body recognizes that damage and tries to fix it. Just as when you have a cut on your hand, the body recognizes that and tries to fix it. When it happens on your hand, and the body puts a little bit of a clot there or scab there, that's beneficial to you. When that same process happens on the inside of the body, inside the heart, that's detrimental. You get buildup of plaque there, and that can cause blockage and cause heart attack and stroke. So smoking is easily the #1 risk factor that we see. And when you quit smoking, you have immediate health benefits, not only from the cessation of the tobacco smoke, but also from the nicotine. So nicotine is a stimulant. Nicotine causes higher blood pressure, causes rapid heart beating. And in only 20 minutes after quitting smoking, blood pressure and heart rate recover from the nicotine-induced spike. So not only is it from the tobacco smoke itself, but it's from the nicotine there as well. In terms of eating better, #2 on the list, you want to generally eat more of this stuff and eat less of this stuff. So, and in general, it's more of a Mediterranean-ish kind of a diet is what you want to follow. Fruits and vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts, non-tropical vegetable oils, olive oil would be better, lean meats, including occasionally some red meat in moderation, but preferably lean red meat. Eating less of saturated fat, trans fat, sodium, fatty red meats, sweets, and sugary drinks. So there's a lot of talk about, recently in particular, about fad diets. Things like ketogenic diets, or Atkins diets, or low-carb diets to try to lose weight. And those diets, they are effective in losing weight. You will lose weight by going with a keto diet. The problem is it healthy for you? And what is the long-term durability of a diet like that? So with a keto diet, what you do essentially is that you cut out all carbs, and so you have to substitute carbs for something you eat. So what are you substituting for? If you're taking something out, you got to put something in. In general, if you're taking out carbs, you're allowed to put in a little bit more fat into the diet. By doing that, if you restrict carbs altogether, eventually you're going to lose weight with that. But the substitution of fats in the diet, generally what we see in these patients is that their cholesterol levels start to rise. And over the course of a long period of time, those elevated cholesterol levels can be detrimental to your vascular system and cause heart attack and stroke. The other problem with these diets is that it's nearly impossible, I won't say impossible, but nearly impossible to be on a keto diet for the rest of your life, right? To say, I'm never going to have carbs forever. That's it, I'm done. Usually you do it for a period of time to lose the weight that you wanted to lose. Then you say, okay, I'm done. I'm going to go back to where I was before. And when you do that, you're going to rebound and gain back all the weight that you lost. So you've increased your cholesterol levels, you've increased your risk of heart attack, and now you're back to where you were because you came off the keto diet. So it's not sustainable. The better approach would be to go with a diet that you can do for the rest of your life. To not yin-yang back and forth, to just lose the weight and then go back to something. It's pick a diet that say, okay, this is how I'm going to be forever. And that's generally more of a well-balanced diet. It's not to say you can never have sweets, because no one's going to do that forever. Who wants to live like that? It's moderating that. It's not to say that you can never incorporate some fats into the diet, but it's moderating it. But it's making sure that this stuff is the staple, is the mainstay of the diet, and then allowing stuff from this column to peek in occasionally. And that is a more sustainable approach to things. It's going to be heart healthier in the long run. There are some hacks to doing this. So if you like a little bit of sweeter food in your diet, I can't eat raw vegetables because it tastes terrible, and I like sweeter foods. So if you roast vegetables at high heat, you'll actually caramelize them and you reduce the bitterness and actually bring out an inner sweetness oftentimes. If you cook more at home, obviously you're going to control the ingredients. A lot of times patients tell me, I don't understand, I'm eating the right stuff. But generally, they're eating the right stuff, but they're eating it out. Generally, when you're eating out, although it sounds like it should be healthy on the menu, the restaurant wants you to like their food and come back and eat more of it, so they load it with salt, they load it with butter, because they want you to like it and have more food. So in general, if you're able to cook more at home and you can control the ingredients, that's going to be better for you. Planning ahead at restaurants. Obviously, if you're going to go out to eat, pick a place where you know that they're going to have some healthier options. Picking stuff on the menu that is low in salt. Salt in particular is going to be a cause of high blood pressure. Asking things to be prepared in a low salt way is often an option. If you say, can I have this prepared, but can you prepare it with low salt? That's an option. And obviously grocery shop wisely. If you don't buy it, you can't eat it. So don't buy it. The other issue that I find is that people aren't aware about what a serving size is. A lot of times people tell me, look, I'm eating what I'm supposed to be, I'm eating what you're telling me I'm supposed to eat, and I'm not losing weight. And oftentimes it becomes an issue of portion control. You can overeat good food, and losing weight is all about calories. Calories in versus calories out. If your calories in are more than your calories out, you will gain weight, even if you're eating salad all day. It's just the way that it is. If your calories in are equal to your calories out, then you will maintain. If it's in the reverse direction, you will lose weight. So the best way to do that is to reduce serving size and increase activity. Increased activity is going to increase your calories out. Reducing serving size is going to reduce your calories in. So in terms of a serving size, a 12-ounce piece of meat, which is usually the small one on the menu at a steakhouse, is actually 4 serving sizes. The serving size is supposed to be, and that's not the entire dinner plate. It's the size of your main meat dish on the dinner plate. It's supposed to be the size of your fists or the size of a deck of playing cards. So a 12-ounce is 4 serving size. So the 20-ounce on the menu, I mean, forget about it. I mean, you've eaten your servings for the week there. So that's important to keep in mind. It's getting used to eating smaller portions. So in terms of drink it, eat it, or leave it, playing a game, wine, is that healthy for you? Should you drink it, eat it, or leave it? So technically, it's leave it, but that's mostly because of the calorie intake that's in wine. There's and alcohol in general. But there's nothing problematic with alcohol itself as long as it's in moderation. A glass or 2 of wine a night with dinner, there's nothing wrong with that if you can tolerate the calories. Now, if you're on a strict calorie diet, it's going to be hard for you to have there's actually a fair amount of calories in alcohol. It's going to be hard for you to incorporate that much alcohol into the diet. But if you can tolerate the calories from a weight perspective, there's nothing inherently wrong with alcohol itself, as long as it's in moderation. We're not going from 1 to 2 doesn't turn into 5 to 6, because then that will be a problem after time. In terms of nuts and legumes, that's going to be a beneficial part of your diet, so that should be on the eat it list. In terms of fruits, that's going to be on the eat it list with some caveats, obviously. If you're a diabetic and your sugar levels are an issue for you, it's hard. You can't eat a lot of fruit all the time, even though that is good for you. Your sugar levels will go up, so that's going to be an issue that needs to be moderated. In terms of that's coffee. So, yeah. In terms of it being on the drink it list, yeah, in moderation is the key. So, caffeine is a natural diuretic. It makes you pee. And a lot of times people come to the office saying, I'm having palpitations and I'm lightheaded all the time. And they're like, well, how much coffee do you drink? I drink like 6 cups of coffee. And it's like, the venti Starbucks thing. So it's like an enormous amount of caffeine. So caffeine is pulling water out of you. So the amount of water you have to drink to make up for the amount of water that the caffeine is pulling out of you is enormous. It's actually hard to keep up with that. In addition, caffeine is a stimulant, can cause rapid heart beating and things of that nature. So it's not that you can't have coffee, but if you're having symptoms, lightheadedness, palpitations, this would be the first thing to cut out. And not to say you can never have coffee ever again, but if you're not feeling well, just eliminate it out front until you start feeling a little bit better and getting a handle on why you're feeling that way. And then, after you're feeling better, add a little bit back and you can find what your tolerance level is. So that would be generally the approach. I bring it up because the symptom of lightheadedness and palpitations are extremely common. I see it all the time in the office, and this is a place to start. Not to say that's going to be the answer for everybody, obviously, but it's definitely a place to start.
So caffeine-free is okay?
Yeah, caffeine-free, so decaf coffee. There is a little bit of caffeine in decaf coffee. It's certainly a better switch. If you're going to switch to something, that would be the better switch to make to decaf. If you're, again though, if we're talking about hydrating yourself, it's hard to hydrate yourself on coffee. It's just hard to drink that much of that stuff and hydrate yourself. So if you're feeling poorly, I would recommend cutting it out altogether and trying to hydrate and seeing how you're doing. If you're feeling fine, but you just want to make that healthy switch, yeah, then switching a little bit to decaf would be better. And again, a cup of coffee a day, there's nothing wrong with that in itself. If you're feeling okay, you can tolerate, that's okay. But if you're having symptoms, cutting it out altogether, at least to start with, is the better approach. Number 3 is getting active. That's that other part of the equation. We talked about the calories in part with your diet and portion size. The calories out part is with staying active. it's hard to tip that balance of calories in versus calories out if you're sedentary and your calories out is really low. You want to increase that calories out, so staying active is going to be helpful. So so what the AHA and ACC recommends is 30 minutes of exercise 3 times a week. A lot of people say, look, we're leading busy lives. I have no time for this 30 minutes. My day, as soon as I get up in the morning, it's nonstop. I go to work, I come home, I cook dinner, do the dishes. By the time that's all done, I'm exhausted. It's bedtime. There's no time to put in that 30 minutes. So one of the ways that maybe you can add the 30 minutes in is by breaking it up into 10-minute intervals. If I told you to wake up 30 minutes beforehand to exercise, you would tell me, no way am I waking up 30 minutes beforehand. But if I told you to wake up 10 minutes beforehand, that seems a little bit more doable. If I told you to take 30 minutes out of your lunch break and walk, you would say, that's half my lunch break. There's no way I'm doing that. But if I told you to take 10 minutes out of that, that seems more doable. Same thing before bed. If I told you to take a half hour, that seems like an eternity. But 10 minutes is doable. So by breaking that up into 10-minute increments, which are more palatable and more accessible, then you can actually get your 30 minutes in 3 times a week. It's just an easier way to fit it in. Yeah. There are thresholds of blood pressure. So here it is, the thresholds of blood pressure. So normal blood pressure is 120 over 80, less than that. Elevated in a mild range is below 130 and less than 80. Stage 1 high blood pressure is less than 140 over 90, so between 130 and 139. High blood pressure, stage 2, is over 140, and very high blood pressure is over 180. So oftentimes, what we start with, the preference is always to minimize the amount of medications you take. That is always the preference. The less amount of medication you can take, the better. So if you're in this range and up, we would try lifestyle modification first. That would be the first line therapy. So if your blood pressure is only mildly elevated, we would say try to reduce your salt intake, because salt is the biggest culprit for blood pressure. Salt causes water retention, and that raises your blood pressure, which is why oftentimes the most common medicine to start with for blood pressure is a diuretic, hydrochlorothiazide, because salt is generally the biggest culprit for blood pressure. So we would try salt reduction, identify things in your diet that may be contributing to higher blood pressure, increasing activity levels. Higher activity levels cause vasodilation, it can drop your blood pressure. So that is the preference all the time if your blood pressure is mildly elevated. If it's significantly elevated, if you come into the office and the blood pressure is 160 and it's consistently 160, it's hard for me to send you home and say, okay, just stop salt and let's hope for the best. If it's pretty elevated, at that point, we're starting a medicine up front with those lifestyle changes. And then if you've shown me that you've made the changes, everything is beautiful, you're 120 over 80 every single visit from there, and we want to say, okay, do we want to start trying to wean off this medicine, that may be doable. The other time that you would start the medication up front in this area is if it's like that and you're the picture of health. You run 2 miles a day, your diet is fantastic, you're lean, there's no room for weight loss, you don't eat any salt, so then there's no room to go with lifestyle. I can see you again in 3 months, but it's going to be the same because we're not going to make any changes. In that case, I would probably start a medication up front in this lower range. So I would say, to answer the question, in general, the preference is always to minimize medicine and to try diet and lifestyle first. There are times where you would use medicine up front, and that's if either I recognize that there's no room for diet because you're already doing everything, or the pressure is in a range where I would be pretty worried about sending you home without putting you on something to lower it. So in terms of what the numbers mean, the top number is the systolic blood pressure, the bottom number is the diastolic blood pressure. So systole is when the heart contracts and sends blood through the blood vessels. That's going to be a higher pressure. And then diastole is when the heart relaxes. There's still some pressure in the blood vessels. It never goes to 0, but it's going to be lower than when the heart has squeezed. Both numbers are important. A lot of people tell me, well, it's okay that my top number is high because my bottom number is good, or it's okay that my top number is good because my bottom. They're both important. That's why we measure them. They both have to be our goal. And remember, the goal here is going to be less than 130 over 80. Higher than 130 over 80, you have high blood pressure. And it's both numbers. not either or, it's an and. So what can high blood pressure do? So high blood pressure, like high cholesterol, like smoking, what it causes is damaging to the blood vessels. And so anything that is vascular, anything that has blood vessels can be injured. So you have blood vessels that go from your neck into the brain, so it can cause stroke. You have blood vessels that go to your eye, it can cause vision loss. You have obviously blood vessels that go to the heart itself, it can cause heart failure, heart attack. You have blood vessels in your kidney, it can cause kidney failure. And sexual organs can be affected as well and cause sexual dysfunction. So there is a multitude of problems that can happen from blood pressure. And as we mentioned, it's particularly scary because you can walk around for years and never know that you have high blood pressure. So getting your numbers checked in other settings like this or the doctor's office is important, knowing where you're at. So in terms of, so that was all in ways to help prevent the onset of heart attack and stroke. What if you're having a heart attack and stroke? You know, what if the cat's already out of the bag? What are the signs and symptoms of that? So the classic one, and would be more common in men, is chest discomfort. It's usually in the center of the chest, a heaviness, a tightness, pressure-like sensation, usually worse with activity and improves with rest. Not always, but usually. Sometimes, though, it can be a little bit more vague than that. It can be just discomfort in the upper body, particularly the left arm. Shortness of breath, a cold sweat for no reason. And women typically present more atypically than men without that classic chest discomfort. Sometimes it could be just nausea and vomiting, lightheadedness, jaw pain or tooth pain, shoulder pain or back pain. So a lot of these are very vague. So you say, well, how do I differentiate some of this stuff from what's from the heart or what's not from the heart? So the way to help do that, so discomfort in the upper body like the left arm. If your left arm hurts, but it's worse when you move your left arm, well, that's a problem with your left arm. That's not a problem with the heart. But if it's like a deep ache in the left arm, and no matter what you do, it doesn't seem right, and no matter what position you're in, if nothing helps or makes it worse, that could be more of a heart condition. Same thing with the jaw pain. If you're having jaw pain, but it's worse when you push on your jaw, or push on the tooth, or worse when you're chewing something, that's probably a dental issue. But if it's just this vague discomfort, and you can't pinpoint where it is, it's kind of deep inside, and nothing you do really makes it better or worse, that could be more cardiac in nature. Especially if it's exertional. If you get exertional jaw pain, like I walk upstairs and I get jaw pain, that would be more concerning for a heart issue. Why would your jaw hurt otherwise if with exertion? Every year, I see a couple of patients. They had nausea and vomiting, they thought that they had just a GI bug, and they wrote out their heart attack at home. And they came finally after a couple of days, it wasn't getting better, and they came in and they've completed their heart attack and there's nothing we can do. So how do you differentiate that? In general, if you have gastroenteritis, you're going to have diarrhea with it. So if you have nausea and vomiting and diarrhea, then that's going to be more likely to be gastro and a GI bug. If you're just vomiting, nausea and vomiting, and you have no diarrhea and your bowel function is completely normal, that would be more concerning. That could this be something else going on? So that's generally the way to differentiate these things, is what's accompanying it, what triggers it, what's going on at that time. In any of these situations though, if you're not sure, just ask for help. Just get evaluated. Because the worst case scenario is to miss the boat and to have a heart attack, completed your heart attack, and now there's oftentimes not much you can do at that point. So if there's ever a concern, just err on the side of caution and get it evaluated. In terms of warning signs for a stroke, there's a mnemonic for that, FAST. So F is for facial numbness, weakness, or drooping. It's usually one side of the face would droop. A is arm, as in you can't lift it up or hold it, so you have weakness. Speech is speech difficulty or slurring of words. Sometimes it's real mispronunciation, but other times it's an inability to name objects. Like you're trying to say clock, but you keep saying the wrong word. Or you're trying to say pen, you keep calling it by the wrong name. So that's a sign of speech difficulty as well. And T is for T, time to call 911 if you have any of these things. And it's important to recognize that time is of the essence in both of these cases. For a stroke, we give this intravenous clot busting medicine to open up the blockage, and generally you have about a 3-hour window to open that up. For a heart attack, we often put in stents into the heart to open up that blockage. And in that case, you have 90 minutes really is the goal, to open up the blockage within 90 minutes of presentation. So these things are really time sensitive. So neither of them are situations where you should say, well, I'll go to sleep, see if I can't, how I feel in the morning, and then we'll see how I feel. That's not the way to approach this. If you truly think you're having a stroke or a heart attack, these are true emergencies, and time is of the essence. So the AHA has designated chronic stress as the new health epidemic for the 21st century. And part of the reason why is because of portable cellular devices, and social media, and things of that nature. You know, not too long ago, when you were at work, you were at work, and when you were at home, you were at home, and that was it. Or if you got into an argument with somebody, you walked away from that argument, and that was the end of it. Now, things follow you around wherever you go. You're never truly off. You're always accessible. You have access to email 24 hours a day, 7 days a week, so you're checking your email, thinking about work issues all the time. There's Facebook and social media things, so if you have an argument with somebody, they post that on social media, and now this is something that you're dealing with even after the incident has occurred. So you're truly never away from this, from stress. It's at your hip pocket at all times. And because of that, there's an increase in levels of stress. And there's a clear correlation between stress and heart disease. Stress increases your heart rate, increases your blood pressure, increases cortisol levels. So there's actually a hormonal effect. In higher cortisol levels, there's a clear association with heart attack. The reason why a lot of heart attacks occur early in the morning is because that's when your cortisol levels are highest. There's a real reason for that. I can't tell you how many patients that I've had true refractory high blood pressure. I had them on 4 or 5 different medicines. Nothing helped. They retired, and I took away all their medicine because their blood pressure went to completely normal. It happens all the time. So there is a real effect of stress on the body. So there are some ways that the AHA recommends you can try to counteract this. I will tell you that there's not a right answer to this. It's whatever way works for you, as long as it's a healthy approach and you're not leaning on alcohol or drugs as your way to relieve stress. But whatever the mechanism is for you, whatever you find beneficial. If you don't have any ideas, count to 10 before you speak or react, and I would say before you send the email as well. Try rereading that. Perhaps you should sleep on it before rereading it. My wife makes me, she has to read all my emails before I send them. That's the rule. Otherwise, things don't go as well. You take a few slow, deep breaths until your body unclenches. Sometimes you're about to say something. Just take a few deep breaths, wait for that 10 seconds, and think about whether you really want to say that. Go for a walk. That can be helpful. Just take yourself out of the stressful situation. Splash some water on your face. See, after that, if you have a different perspective on things. Sometimes meditation or prayer. And meditation doesn't necessarily have to be a yoga position. It's sometimes just deep breathing, quiet room. Whatever is you find to be a peaceful, sometimes it's reading, whatever it is that you find to be a release. If it's not urgent, let's sleep on it, respond tomorrow. Sometimes things are a little bit better with some time. Exercise can be excellent. Takes your mind off of it, exhausts you in a different way, physically, and then sometimes things don't seem as important. Another heart sort of healthy quiz here. Is it heart healthy coconut oil? It seems like it should be, right? Sounds like it would be healthy. Coconut grows on a tree, it's natural, it's healthy. It's actually loaded in saturated fat. It's actually not healthy for you. Is it heart healthy fat? Sort of a trick question. It depends. It's certainly saturated fats are not going to be good for you. Trans fats are not going to be good for you. But as we talked about before, there are 3 food groups, right? There's carbs, fats, and protein. If you remove all fat, you have to put something in there. Oftentimes, it's going to be carbs that you put in there, and then you're going to create other issues for yourself. So it's not that you can never have fat, it's moderating it and picking which kind of fats you're going to choose. E-cigarettes, are they heart healthy? So research is ongoing. There's certainly a lot of case reports of lung toxicity from e-cigarettes. Most of those are with combined marijuana and nicotine e-cigarettes. There's very few case reports of just the e-cigarettes by themselves. So what do we do with this? I would say that long-term use of this probably is not going to be good. Direct inhalation, we don't have any long-term data on it because they haven't been out for that long. It's hard to imagine that inhalation of nicotine smoke over the long period of time is going to be healthy for you. At the same time, though, I know for a fact that tobacco smoke is terrible. So oftentimes what I do in this situation with this is say, look, if this is what we need to do to get you to quit smoking and get you off tobacco, then so be it. With the understanding, though, that that's a bridge and it's not the answer, and then we're going to eventually have to get you off of this too. If you can quit smoking without it, that would be better. But if you can't, and some people can't, and we need to use this as a crutch for a short period of time, temporary, then we got to do what we got to do to get you off of something that I know is toxic, and there's a ton of data out there that is awful for you. But it's hard to imagine that long-term use of inhaled nicotine smoke is going to be particularly healthy for you. So this is sort of speaks to that, is that there is some data now that suggests that exposure to e-cigarette liquid can be harmful. It's usually through the idea is that it's directly pulmonary toxic, and that it can cause, so there's a lining between the lung spaces, and it can cause damage of that lining, of those separations, and cause something called honeycombing in the lung, or more commonly called popcorn lung, because you eliminate the small barriers between the linings in the lungs. And it's between that barriers where gas exchange occurs. So if you lose that barrier, you have less surface area for gas exchange, and your exercise tolerance goes down and you have less lung capacity. So that's the issue there. And there's an increase in number of calls to poison control centers for e-cigarette exposure. Particularly problematic is the use of e-cigarettes in younger people, because they're, the one advantage that people thought was going to be for e-cigarettes is that they're not foul smelling and they don't taste as bad as cigarettes or things of that nature. But that caused a whole different problem. It caused it so that it's more accessible to younger people who now can use nicotine without the smell and without the foul taste, and you can make them in different flavors, and it makes it more accessible to young people, which has been a big issue. Isn't heart healthy catching up on sleep? It is. There is a diurnal variation in heart rate and blood pressure. During periods of sleep, it's clear. There's a drop in blood pressure and there's a drop in heart rate. There's a drop in cortisol levels. Getting regular amounts of that in a day is helpful. The other thing is that if you're not getting enough sleep, you're often relying on stimulants to get you through the day. More coffee, more sugar, to try to increase your energy levels, to try to push yourself through the day. So regular sleep is healthy. In terms of fresh vegetables or frozen vegetables, is one preferred over the other? They're the same in terms of vitamins and minerals, but you need to be a little bit careful with the frozen stuff, because generally the only way to preserve something that's frozen or canned is with salt. So there may be more sodium in this section here, so you need to be a little bit careful of that and pay attention to labels. Having good oral hygiene, is that heart healthy?
Yes.
It is. Hard to imagine, well, what's the connection there? So the first step in the process of plaque buildup in the heart is inflammation. That's the first step. Before the plaque develops, before cholesterol deposits go, inflammation is the first step. So there are conditions where you can have chronic levels of high inflammatory markers, such as gingivitis, which is a chronic inflammatory condition of your gums, which can cause higher inflammatory levels through the body, which can then predispose to increase in levels of inflammation in the heart, which can lead to plaque development. There are some levels that oftentimes we check in the office called a CRP, which will tell you what your levels of inflammation are, and it can tell you where you are in that spectrum. And we often use that as one of the risk markers. Other chronic inflammatory conditions, such as lupus and things like that, those are autoimmune inflammatory conditions, are known to have a little bit of a higher incidence in heart attack because of that chronically high levels of inflammation. And the other way that oral hygiene can affect the heart is Sometimes if you have a little bit of an abnormality in your heart valve, that could be a nidus for bacteria to deposit there. And if you don't have good oral hygiene, bacteria can enter the bloodstream when you're brushing your teeth. If you have a normal heart, you're fine. If you have a heart valve abnormality, sometimes that can deposit on the heart valve and cause something called endocarditis, which is infection of the heart valve, which is not great to have. Eating your food quickly, is that heart healthy? It's not, and mostly you're not allowing time for adequate digestion and to unlock the natural ingredients and minerals and vitamins of the food. But also, the faster you eat, the more you tend to eat. So it's hard to have portion control if you're eating very quickly. Gluten, is it heart healthy? If you were to read advertisements, it sound that gluten is a scourge of the 21st century. Gluten is awful for you. And it's not. It's gluten is bad for you if you have celiac disease, which is a true gluten insensitivity. In the absence of celiac disease, there's nothing wrong with gluten themselves. Now, the stuff that often has gluten, such as carbohydrates and bread products and stuff like that, if you eat too much of that stuff, that won't be great. But it has nothing to do with the gluten. It's all the carbs that you're eating. So gluten itself, if you do not have celiac disease, there is really no downside to it, as long as you're moderating the types of foods that have it in it. Let's get to the question earlier, table salt, sea salt, kosher salt. Yeah, they're all the same generally. It's all about sodium intake, and we really need to moderate that. So after you've taken these life's simple 7 steps, you're improving your own quality of life, you'd be surprised at the effect that's going to have on the people around you. You're a role model without you knowing it, to your spouse, to your children, to your coworkers at work. People watch and they recognize and they see what you eat and what you do. And you'd be surprised about how living a healthy lifestyle for you can rub off on people in your immediate neighborhood. And that's all I have for you.